We have an extraordinary platform for education at Washington University. It begins with patient care. At Washington University, we see about 180,000 patient visits a year and do about 17,000 surgeries. The types of pathology that come in, the mix of patients, the challenging situations are very important. But most important, really, is the way our faculty engage in education. They're committed to resident education. We are a resident education first program. On average, our residents do about 2,200 to 2,300 surgeries per year, and they come out with a tremendous background in clinical care. And moreover, they have a great knowledge base about orthopedics. All of our conferences are taught by faculty. These are leading faculty in the world. These are people who individuals from around the world come to learn from. They're invited for major symposium talks at national and international meetings, and they're the people who teach you in these conferences. So from a combination of our clinical care, our didactic teaching, we train extraordinary residents. Our commitment as a department is to make a difference. We want to have an impact. We want to have it locally, regionally, nationally, and internationally. We want to change the face of orthopedics for the future in terms of diversity. We want to lead to innovation and discovery and change the way patients can receive care. You know, my goal as a chair really is to get outstanding people here, provide them the resources they need, and in that great environment, outstanding people will achieve. So provide those resources and allow people to have a high ceiling, higher than anywhere else in the country. My goal is to make sure that if you come to Washington University, you're going to do better than you could have done anywhere else in the country.
Hi, welcome. I'm Sandra Klein, and I am the program director for Washington University Orthopedic Residency Program. And I'm here with...
Hi, I'm Alexander Aleem. I'm the Associate Program Director for Washington University Orthopedic Surgery. We are excited to have you here. Congratulations on picking orthopedic surgery as a specialty. Obviously, Dr. Klein and I are quite biased, but we think it's the best specialty out there. It takes a lot of hard work and dedication to commit to orthopedic surgery and to getting to this point. So first of all, congratulations on making it here. You are a select group of students, and we're really excited to have you.
I really think that orthopedics has something for everyone. Wide variety of patient populations, lots of different types of problems, some short-term, some long-term. There's really any type of problem or patient that interests you. I think you can find it in orthopedics. So, Dr. Aleem, I think that one of the things that really defines our program is our commitment to excellence in education.
I would totally agree. I think, you know, as a graduate of this program recently, this is a resident first program. As we mentioned, we really build it on education, friendship, and building the future of orthopedics. Every day we think about how can we make our residency program better, and making the resident education a priority is something that's been a commitment of the department, I think, for a very long time.
And I think you said it perfectly when we talk about a resident first program. What we really mean is that decisions that we make, whether it's in our clinical work, research, or how our department is organized, we always take into consideration how it's going to affect residents and education, and we make that a priority. The clinical work that we do is really the foundation of our educational program. We have a big faculty group, about 66 clinical faculty. I would say most of the people here that you see are surgical faculty, but we do have a physical medicine and rehabilitation group. These are non-operative musculoskeletal specialists who work in the orthopedic department.
I think one of the things that really makes our program special is we have a wide variety of facilities that you as residents will be able to rotate. They're world-class, you know, obviously Barnes Jewish Hospital in sort of the Central West End, main part of St. Louis, which is the picture on the upper right here is really the hub. It is a top 15 hospital in the country. It's a level 1 trauma center, the biggest hospital in St. Louis, and consistently ranked #1 hospital in Missouri. St. Louis Children's Hospital, the main hospital, is on the main medical campus. as well as a Shriners Hospital, which is a really great opportunity to see some really unique things in the pediatric world. Additionally, you get exposure to a VA hospital, which is not too far from the main campus. The VA population is a very unique population, and our residents really enjoy that. And we also have a really great, robust ambulatory surgery experience. There's a orthopedics surgery center out in Chesterfield, which is exclusively orthopedics, both from a clinic outpatient as well as an ambulatory surgery center. We also have a ambulatory surgery center down in South County. And then finally, one of the things that's recently happened is a shift of a lot of our total joint surgeries to a new hospital in West County called Barnes-Jewish West County Hospital. It's a center for excellence for total joint arthroplasty. We are seeing some of our shoulder arthroplasty as well as simple spine procedures transfer out there as well. It's a really nice facility, gives you a bit of a flavor of a bit more high efficiency, but also being able to perform some of those more inpatient surgeries. This map here kind of gives you a little bit of a layout of where the facilities are. The star kind of closer to the center of St. Louis is where the main campus is, and the other stars are where some of those other outside sites are. Just for reference, probably the longest that you would drive would be about 10 to 15 miles from the main campus. And with the traffic in St. Louis being relatively easy, probably the longest you spend in your car is maybe 20, 25 minutes. So pretty easy drive to get to any of the satellite centers, even from the main campus.
One important comment to make is that our residents do take call at our main hospital. It's a level 1 trauma center. They are not responsible for call duties or call responsibilities at the surrounding centers.
I think that's a really important point. This zoomed in is a little bit more of where kind of the Central West End is, which is where the Barnes-Jewish and Washington University main medical campus is. You can see it's tucked right next to Forest Park, which is one of the hidden gems, I think, of St. Louis. And you'll probably hear a little bit more about that from the residents, but huge in-city park, lots of access. Nice to have a greenery area that you can look at from the hospital. The other star on the right of the picture is where our VA hospital is. It's a little bit further downtown, closer to St. Louis University. It's about a mile away from the main medical campus. Again, easy access from the main medical campus. And a lot of the residents do choose to live sort of around this area as you spend most of your time here. And as we mentioned, pretty easy access to the highway right there, 64 and 44, to get to the other centers. One of the things that we really also pride ourselves in our program is the robust clinical experience that you get as a resident. This graph here just shows the level of growth with our outpatient office visits. As we've mentioned, we've been able to expand to other satellite centers to give access to patients. I think one of the things that's been really unique is that we realize that patients sometimes don't want to come to the major medical center. It's sometimes difficult to access, and patients do come from a far away to see us. And so by having some of these centers in other areas in the city and the surrounding areas, we can provide excellent orthopedic care to a wider population. And this is shown in this graph here. We have an average increase in our outpatient office visits by about 7%, and that number continues to rise each year. You can see the breakdown of a lot of our different centers and how that's really helped expand our outreach and our footprint within the St. Louis area. Similarly, our surgical volume has increased along that same sort of trajectory. We're able to do a lot of surgery, especially at our ambulatory surgery centers at Barnes West County. With a bit more efficiency, we can increase those volumes and really give residents a great surgical experience. And so most residents will probably log by the end of their 5 years somewhere between 1,700 to 2,000 total procedures. And we'll get into this a little bit later, but these are procedures a lot of times when you are the primary resident surgeon in the room, you're not double scrubbed. So you really, not only is it volume of experience, but it's also the quality of that volume, really being able to get great exposure from a surgical standpoint.
And you get experience in every subspecialty. Within our department, we have divisions representing every subspecialty of orthopedics. We're all part of the same department, report to the same chair, and share the same vision for orthopedic education. And I think that's a real strength of this program. no matter what facility you are working with or working at, the faculty involved are part of our department and part of our core mission. So the next part of this presentation is about our program structure, which really is focused on the details of how you spend your time as a resident in this program. We do take 8 residents per year. And if I had to sum up our program in one phrase or one sentence, I would say that it's a program based on graduated responsibility. We really emphasize leadership, we emphasize teaching, and faculty are committed to education and teaching others, but our residents are just as committed. And everybody plays a big role in training our residents and helping them grow as surgeons. So as you become more senior, your focus, part of your focus or your responsibility is to participate in training the junior residents.
So the intern year is broken into 2 sort of 6-month blocks as kind of required by the ACGME and the ABOS guidelines. You have 6 months of true orthopedic rotations and kind of 6 months of other rotations. So the orthopedics rotations, you'll spend some time on the trauma service, the pediatric service, a little bit of the night float, which is kind of with the trauma service again, as well as with the sports and tumor services. We think the benefit of being on the trauma and the pediatric service early on is, one, you get to kind of understand a little bit of logistics of both of the hospitals, understand how call works, how to manage a consult. You will be holding the consult pager during the majority of the time on both the trauma and the pediatric service. So you'll be able to go to the emergency department, assess patients, understand injuries, understand how the ER works, really get to build some connections to help when you go into your junior call later. You do get some operative experience in those times as well, but we really want to have the focus on those rotations being understanding how to take care of patients or orthopedic patients. Night float rotation is really taking care of the orthopedic inpatients overnight. It's a busy service at Barnes-Jewish Hospital. A lot of sick patients and a really good experience. You will have a backup with a PGY2 who will also be there, so you're not alone. The sports service is great. It gives you a little bit of a break from the main hospital. Also gives you a bit of exposure to some of the ambulatory surgery centers and a bit of a different exposure to some of the attendings that may spend more of their time out at Chesterfield or at South County. And then finally, the tumor service, I think, is one of the highlights as well of the intern year. It's a really heavy operative experience as an intern. You get to see a wide variety of cases from primary total joint arthroplasty to complex tumor reconstruction surgery. And the interns really get a great experience on that service. As you can see, the other months, I'll spend a little time talking about surgical skills at the next slide. But 4 months of really true general surgery rotations. And we've been very thoughtful in what rotations we pick. So the surgical ICU, I think, is really helpful. We think is really helpful because it really gives you an access to how to take care of high acuity patients. ACCS is essentially the general surgery trauma service. So a service that you're going to spend a lot of time integrating with, especially when you're on trauma. So getting to understand how to take care of general surgery patients. ER, obviously, same kind of idea, getting to understand the logistics of the ER, getting to make some connections there. And then plastics, we spend a lot of time collaborating with our plastics colleagues, get to spend doing some hand cases, as well as really learning how to manage soft tissues and spend a lot of time building up some surgical closures. You will spend a month with our physical medicine rehabilitation physicians as well. This is a really great month to learn some of the nuances of a musculoskeletal physical exam and get just a little bit of a different perspective on how to take care of musculoskeletal problems from people that aren't surgeons. And we think that's a really valuable educational experience. So the surgical skills month is 1 month that we spend during the intern year. And this is something that has now been a pretty mature change in orthopedic education, where there is some requirement to have dedicated skills. And that can be really anything up to the program's discretion. And we felt that doing a month, really giving a deep dive into the surgical skills was really beneficial. This is typically during January, so it's about halfway through the year. So you've gotten to understand a lot of the lay of the land. You've gotten to know the hospital. You've gotten to kind of settle in a bit. And it does give you a little bit of a break from some of the rigors of intern year to have that entire month. It's a comprehensive subspecialty educational program that goes through all of this: anatomy, didactics, tactile surgical skills, both on cadavers, sawbones, and virtually. And we think the really important thing here is it's faculty taught. So during each module, have a faculty member leading the discussion, teaching the skill session, and really moderating everything. And the faculty really get to enjoy this as well. Some of the other benefits of the month we think are, one, being able to have some camaraderie with your intern class. It's You see each other right at the beginning of the year, and then you kind of spread out to all your different rotations. And so having that month together kind of halfway through the year, being able to see everybody almost every day is really, really great. And it really builds up some team morale. And the other thing I think that's really helpful is you get to interface with pretty much every clinical faculty member during that time. And so you may have a couple hours or a half day with a certain faculty member. And then when you come back to rotate with them later on, either as a junior resident or as an intern, they get to know you. They know your face a little bit. They know your name. So it gives you a nice introduction. So allows you to sort of build some rapport with some of the faculty later.
That's a great summary of the intern year. And I think it really creates a good base for what comes next. When we put together our resident education program and thought about our rotations, our goal is to train our residents to be outstanding orthopedic surgeons. And we want to make sure they have options available to them, no matter what they want to do after they leave our program. So in the PGY 2 and 3 year, our residents rotate through every service. In the PGY 2 year, they will spend 6 weeks on some services, foot and ankle, adult reconstruction, a night float rotation, and a research rotation, which I'll talk a little bit more about on the next slide. And then there are 3-month rotations that stretch across the PGY 2 and 3 year. So our residents will do 2 of these 3-month rotations in their PGY 2 year and 2 of them in their 3 year. And we think of these 2 years really as a continuum. These are the junior resident years. Residents do take in-house call during this time. They're really gaining a wide variety of experiences, and different rotations may have different models, whether it's a mentorship model or a team model. And there's a lot to be learned during this time. The PGY 2 year is a big year. You do get a 6-week research rotation. Dr. Mike Kelly, he's one of our spine surgeons. He really leads the program. He's a mentor to all of our residents during the research rotation and throughout their residency to help them complete their research project. We require 1 project, publishable by the time of graduation. Everybody presents it at graduation. And we give you this dedicated time in your PGY 2 year to get started. It's not going to be enough time to finish. You've all done research and you know that it takes time. But we want to give you some time to focus on putting together your plan. And that's really what happens in the PGY 2 year. We have a research center, really kind of a division that contains a lot of research resources, which include an epidemiologist, a statistician, access to people that will help write grants, help submit grants, and then also IRB submission. So we have a robust program, and our goal is to make sure that that 1 research project is completed, but also that it's done well, that it's quality research, and that you learn a lot in the process.
So the PGY 3 year, as Dr. Klein said, is kind of thought of as a continuation of that PGY 2 year. Obviously, the main difference is being you don't have the night float rotation, so call responsibilities are potentially a little bit less, but you still are in that junior resident phase. So the 6-week rotations that you spend during your 3rd year are the VA, which we mentioned as really a highlight and kind of an experience to get a little bit more autonomy than in some of the other junior rotations. You'll spend 6 weeks on the sports service, come back with the tumor service, and then the shoulder and elbow service. Again, a good mix of both heavy inpatient services as well as more outpatient services, and a good mix at our different centers. The 2 3-month rotations that you didn't do your PGY 2 year, you'll then do your PGY 3 year. And again, really, we think of these rotations as being core rotations that need a little bit longer time because of the importance that they have, as well as the busy services just to help kind of with maintenance of care and everything like that. So the other aspect of the PGY 3 year is you do spend a lot of time on Saturday call, our residents dub it Super Saturday, where you are covering both the adult and the pediatric hospital with one of the interns. It's a really great opportunity to sort of start teaching a little bit early on, really help develop the intern's skills in terms of seeing consults, juggling busy days and nights on call. And you get an opportunity to operate on some of the weekend trauma cases as well. So it's a really great experience and a really great exposure. And I think one of the things that the PGY3 class looks at as one of the best challenges for them to kind of handle.
And then once that year's done, you've seen everything, gotten exposure to every subspecialty, and our residents, I think, feel ready when they move to the next year. So the PGY4 year, now you're a senior resident, you're a chief on many services, and there are some 6-week rotations that happen in the 4th year: hand, foot and ankle, another research rotation to give you time to finish up that project, hopefully tie up some loose ends and make sure you have everything on track, and then shoulder and elbow. We have 3-month rotations that stretch across the 4 and 5 year, and we do think of these 2 years as a continuum once again. So adult reconstruction, trauma, sports, and pediatrics show up here as 3-month rotations.
And then finally, you made it. You made it to the chief year, the PGY 5 year.
Yay.
Woohoo! It's a big accomplishment, and really, I think a lot of leadership comes from this role here. So during the 6-week rotations, you're back at the VA. The chief at the VA has a lot of responsibility, taking care of a lot of the ins and outs of the VA. The tumor service, again, you're the head of a busy tumor service, a lot of sick patients, a lot of complex surgeries. You'll spend 6 weeks on spine, and then you spend 6 weeks on what we call the super chief rotation. Super chief rotation is an elective rotation where you really get to kind of pick and choose and craft a rotation that makes the most sense for you and your goals. Combination of being able to go to surgery as well as some research, potentially tie up some loose ends in some of those research projects, but really be able to kind of pick what you want to look at. If there's an interesting case that you want to scrub in on, you're more than welcome to do that. If you want to focus on certain skills to maybe prepare you for fellowship, great opportunity to do that. And then, of course, the other 3-month rotations that you didn't do your PGY 4 year, you'll complete your PGY 5 year.
And then you're ready to move on to the final step, fellowship or independent practice, if that's what you choose to do. So I think it's important to touch on a few educational resources that we have. Some of the things that maybe help the resident experience. I think our education program has a lot of great resources available, and we do a lot of things to make sure that we support our residents and their learning. We have a great didactic program. We're really proud of this. You know, we have our core lectures on Tuesdays. Grand rounds are reserved for guests. We have a leadership program where we have a lot of leadership-oriented lectures on that day. And then our interactive sessions are case-based sessions that happen on Thursday. These are all conferences that all residents attend, but within every subspecialty, there are clinical conferences, and whether that's indications conferences, anatomy sessions, journal clubs, we have educational programs going on pretty much every day of the week. And so for whatever subspecialty service you're on, you'll get a lot of extra education. So it's really robust.
We also have a repository of what we call essential readings. And one of the most frequent complaints of residents around the country, especially I think junior residents, and I can speak from my own personal experience, is where do I start? You know, how am I supposed to read? You're being told to read for your rotations, to read for surgery, and studying in residency and even in clinical medicine is very different. There's not a lot of great, there's a ton of textbooks, but what articles to read, what chapters to read. And what we've done is we've created this essential readings. And so what that is a group of about a manageable load of 150 to 250 pages that has been picked out by the faculty members on each service for appropriate level of resident on each service, of knowledge that they should have, whether it's a book chapter or classic articles to reference, These are compiled and accessed on our online repository, and it gives you a good jumping off point. It's a good starting point to help with individual study. It can lead to other studies to read, other book chapters, read to some questions, try to help stimulate some discussion with your faculty mentors. I think this is a really good repository of the jumping off point, and it really helps focus some of the study, especially in a rotation or in a subspecialty that you may have had no experience with in medical school.
And we like to keep the focus on education. You know, we want everybody to have time to focus on those essential readings and take the time to build their orthopedic knowledge base. And that can be hard to do. Residency is challenging, but we do keep a night float and a night intern rotation so that we minimize call for everyone else. So you don't have to be on call extensively while you're on other rotations. Children's Hospital, it's home call whenever possible. In the summer, that's hard to do, but once winter hits, it's dark, it's cold, there's less going on in the St. Louis Children's Hospital emergency room, so it's a little bit easier for residents to take call from home. We do enforce duty hour restrictions the next day, no matter what happens on call. So after residents are on call at Children's Hospital, they actually leave after they finish their morning responsibilities the next day. And then nurse practitioners are a big part of what we do. They're important contributors to patient care. And they take care of a lot of inpatient floor work so that residents can focus on the work that's specific to their role in terms of taking care of patients and being in the operating room and learning how to be great orthopedic surgeons.
Question that we get asked frequently is about mentorship, especially if you're coming to this program and you don't really know anybody in the Washington University community. It can be a bit intimidating. So what opportunities are there for mentorship? And we think there's informal mentors that you'll develop throughout the course of your time as a resident, faculty that you may click with on a service, senior residents that you may kind of interact with as well. But we also really want to have some formal mentorship to make sure that you're getting good advice and getting regular feedback and regular check-ins. And so we assign 2 mentors on match day. So when we find out who our 8 residents are, we assign them mentors and we tell them who they are. You'll have faculty that you meet with quarterly throughout your 5 years. And then typically we'll also pair you up with a resident that's going to be about 2 years ahead. And the resident mentor can be something simple as, where do I need to live? What are some good places? What are, schools if you have kids? Can really help with a lot of logistical questions about starting residency. You will have a research mentor as well. As Dr. Klein mentioned, Dr. Kelly is sort of a formal mentor for everybody sort of throughout the research process, but you'll have faculty that you work with on smaller program on your individual projects with, and you develop those relationships that way. And I think you really benefit from getting a lot of different influences and a lot of different mentor relationships throughout the residency here. There are people that I still lean on that were mentors of mine during residency. And I think this is true amongst all the graduates of our program.
And we also get a lot of questions about evaluations and feedback. And the answer is yes, we have those. We try to give timely and effective feedback on every rotation. I think it helps to kind of know in the moment what you can do to get better, what you did well. But faculty do evaluate residents at the end of each rotation, and residents evaluate our faculty. And I think that's a really important point to make because our faculty are interested in improving as teachers and educators. There is resident-to-resident feedback. Dr. Aleem and I meet with everybody twice a year. We make sure that we give feedback and let you know how things are going from our perspective. You'll meet with your mentor once a quarter, and that's an opportunity to get feedback. And the OIE, it's a bit of feedback about how you're doing in terms of building that knowledge base. For the most part, I would say Dr. Aleem and I have an open door policy. We're really here to meet with residents whenever they need to meet with us. We listen to feedback from them anytime they have feedback to give us. And we really try to make sure that we are communicating openly with residents all the time about what we're doing and how we're trying to improve the program. So we've given you a lot of information, but the question I'm sure that's on everybody's mind is, hey, why Washington University?
And this is a question that we get asked all the time. And I think both Dr. Klein and I agree. It's our people, our group of residents, which you see here. They are our greatest asset for the program. It's an amazing group of energetic, diverse, thoughtful, wonderful physicians who are going to be amazing orthopedic surgeons. They are a joy to teach, they're a joy to work around. And it's one of the main reasons that I personally love being affiliated with WashU, is to be able to work with such a great group of residents.
Yeah, I would absolutely agree. I think we have a great program. I think we put a lot of thought into how we educate residents, but without this group of residents, and quite honestly, our faculty too, it wouldn't be the program that it is. The people really, really make it special. So I think we'll end on this note. We hope you consider us. I really thank you for your time. And I know I'm looking forward to meeting everyone during the interviews.
Yes, thank you. Thank you so much for taking the time and bearing with us through uncharted territories in the 2020-2021 application cycle. It's going to be new territory for all of us, but we really hope you consider us as your program. We think we have, if not the best, one of the best orthopedic training programs in the country. We're really proud of it. We're really proud of our people, and we look forward to getting to know you.
Thanks, everybody.